Choosing the right speech sound disorders intervention and why most people get it wrong. Hi, I'm Amy Graham, a speech language pathologist in Colorado, and I specialize in speech sound disorders. If you watched my video from last week, we talked about differential diagnosis. And the reason differential diagnosis is so important and understanding what subtypes a child presents with is because that will determine what interventions you're going to choose, because particular interventions, if you match the intervention to the deficit, you're going to see quicker progress in therapy. You're going to get kids off your caseload faster. You're going to get families that won't need you any longer. So that is always my goal. Now, I suspect that most speech language pathologists use what we call a traditional articulation approach. That approach is where we look at the child's speech system, we look at the sounds that they're not exhibiting, and that's what we want to target in therapy. So we tend to identify that sound maybe and just focus on them one at a time in therapy using what we call an articulation hierarchy. So we're targeting, let's say, the S sound in isolation until they get that right. And then we're going to focus on working on the S sound in syllables, and then in words, and then in different word positions, maybe at the beginning of a word, then at the end of a word, until we can work on those words in phrases and in sentences, and so on, in more increasingly complex phonetic contexts. Now, that approach is a great approach for a child who has an articulation distortion, a motor-based subtype speech sound disorder. So we're going to focus on that sound one at a time, in that hierarchy. That's totally appropriate. However, if you have a child with other types of speech sound disorders, like for example, a phonological impairment, a child who they're not lisping the S sound, but maybe they're stopping the S sound. So they're using a stop consonant like a T in place of an S. And so if you just target the S sound, you might find that you have a child who will struggle eliminating the T sound in a word like soap. So it might sound like stope because they're inserting that stop consonant, right? They don't understand that instead of the T, we need to use an S. So for a child who's doing a phonological type of error, we need to use a phonological approach. And so if you have a child, let's say, who's stopping, you have several ways to treat that. So you can use minimal pairs. Minimal pairs is a great intervention for children who are on the milder end of the spectrum, who maybe only have 1, 2, maybe 3 at the most phonological types of errors. And what we do with those kids, let's take a child who is fronting, right? Instead of key, they're saying T. We're going to get pairs of words where we're going to teach them the rule that T is different from key, and we need different sounds to change the meanings of words. And that's what phonological interventions do. They help the child understand that sounds change meanings of words. Because if I took that child who's saying T instead of key, and I teach them the K sound, and I use a traditional articulation approach, guess what's going to happen? They will likely overgeneralize that K sound, because if you're just drilling a bunch of K words, you're teaching the child a rule, but the rule that you're teaching is that we don't need T anymore. And so you'll find that that child may actually lose the ability to say the T sound now. That's what happens when we treat a child with a phonological impairment with an articulation type of intervention. So we need to choose, for kids with phonological deficits, we need to choose interventions that will not only teach them the rules for how we use sounds in language, but that will also improve their speech system systemically, right? Like the whole thing. Because if you have a child who's missing so many sounds, let's say they're stopping and cluster reducing and fronting and gliding, that's a lot of sounds that that child is missing. So if we use an articulation approach and we're just going to target one at a time, let's say this child is 4, that child's going to be in therapy forever before you are able to get through all of those sounds. So what I encourage you to do for those kids who maybe are on the more moderate to more severe end of the spectrum when it comes to phonological interventions, choose an approach that will help change that child's speech system in a more efficient way. So for example, we need to think about target selection for our kids, particularly with phonological impairments. We need to think about what can we target in therapy that will actually improve their speech system quicker. And this is where I want to encourage you to learn about the complexity approach. Now, I have a whole 1-hour course teaching about this approach that you might find helpful if this is a new concept to you. But what we're doing, instead of that traditional approach where we might take that 4-year-old, look at all the sounds they're missing, and we think, let's work on the sounds that they should have had at the age of 3. We can do that. and they'll make some progress, but they will only improve those early developing sounds. Where if we use a complexity approach, where we look at things that are more complex, that are even beyond their age expectancy. So let's take maybe a cluster. And if we focus on a cluster in therapy, what happens is a trickle-down effect, where not only do clusters emerge, but earlier developing sounds begin to emerge on their own, because you're changing their speech system from a generalization standpoint. So you're getting this broad generalization, not just the sound that you're targeting, generalizing to their spontaneous speech, but you're getting a cross-class generalization. Because if we target the right cluster, what we'll get start to merge spontaneously in their speech are affricates, ch, j, fricatives, s, v, sh, and stop consonants as well too. So it's kind of the work smarter, not harder approach to remediation for children with more severe phonological impairments. So I want you to think about what subtype does your child have, and what approach should I be incorporating into that intervention that we're using. So now what I want you to think about too is the other subtypes that we have, like impairments of motor speech. So if you have a child, let's say with apraxia, childhood apraxia of speech is not a deficit of sounds, particularly. It is a deficit of movement, of motor planning, motor programming. So the child knows what they want to say, but that message gets jumbled as it makes it to the mouth, to the articulators. And so that's why we see particular characteristics among our kids with apraxia, like inconsistent productions, like deficits of prosody, difficulty with movement from sound to sound and syllable to syllable, so that you see things like an intrusive schwa pop up there. You'll see inconsistent voicing errors, just because that child has a movement-based deficit. So for those kids, we really need to consider not using a phonological intervention, not using an articulation intervention, because that is not their deficit. Now, they may also have those subtypes going on, but if you have a child whose primary deficit is apraxia of speech, we need to focus on interventions that will focus on movement. So for example, I love dynamic temporal and tactile cueing, developed by Dr. Edith Strand, and this is where we're working on movement gestures. So when we say a target selection for these kids, we're not talking about sounds, we're talking about words or talking about phrases, whatever that child, whatever complexity of speech targets they're ready to work on. So for example, if I have a child who has apraxia, I'm going to want to target things that will improve their functional speech, help them be more intelligible. And I might choose a small handful of words, 10 at the most, that we're going to be working on, because our target is going to be a particular movement, or i.e. word. So for example, can they say their name? That might be one of my targets, as long as the child has all those sounds in their inventory. Because here's another thing about childhood apraxia of speech. We want our practice to be accurate, because how it's practiced is how it will be retained. So we need to choose our targets using sounds that the child is able to produce, whether in their inventory or something that you can cue them for accuracy based on all your multisensory cueing. So if the child's name is Mark, right, they need to have the M sound. We want to cue them for a closer approximation of that post-vocalic R. If it's not perfect, maybe we can work towards that, but then can they say the K sound? If they can't, then I'm maybe going to focus a little time on eliciting those particular sounds, so that down the road we can work on that as an actual target in our speech therapy. So what you do is we're going to take that word, Mark, and we are going to use that target and practice it hundreds and hundreds of times until it becomes automatic, until they can utilize that word in functional spontaneous speech outside of your therapy room. So if we need to work on that word Mark hundreds and hundreds of times, we're not going to be working on tons of words in our therapy. We're going to have smaller therapy lists of words that we're going to be targeting. And then we're going to use an approach like DTTC, which you can get free training on my resources page on my website, linked to Dr. Edith Strand's free course that you can access for 6 hours of free CEUs. Now, what if you have a mixed speech sound disorder? I understand, like, it can be really difficult to decide what approach you're going to use if a child has multiple things going on. This is where our clinical reasoning comes in and our clinical judgment. When you eval that child, you have to determine, okay, what subtype is really impacting that child the most? Because I may have the child that has all three subtypes going on, but If I have another child with all the same 3 subtypes, maybe it's that lateral distortion that is primarily their issue. Maybe this child, it's the apraxia that is the biggest issue for them because they really struggle with that consistent, fluid, accurate movement of speech, not just about the particular sound. So this is where we can blend aspects of different approaches in order to make sure that we're really targeting what we need to target with those kids. If you struggle with identifying what approach to use, I have a 2-hour course all about looking at particular cases and helping you decide what's going to be the most appropriate approach. And we go through and we outline why that approach is effective. I show you how you can implement it, real therapy videos to demonstrate. So if you want more information about that, there is a link below.